And we are on your side tracking the very latest on the coronavirus pandemic. Governor Bill Lee responding to criticism over his safer at home order. This after the governor issued a safer at home advisory Monday that does not have a mandate. Some have questioned whether Lee's urgings are enough to stop the spread. State Capitol Newsroom reporter Chris Bungard takes a look at the lingering issue.
The voices of dissent remain firm in their opposition that Governor Bill Lee hasn't done enough to keep Tennesseans at home.
We need a shelter-in-place order that's enforceable.
We have to have a mandate.
During the course of the COVID-19 pandemic, Governor Bill Lee has said there's a critical balance to maintain about people staying at home. It was clear in his Monday order.
This is not a mandated shelter-in-place order, because it's deeply important to me that we remain a state that protects personal liberties. But it is a strong urging for Tennesseans to stay home when at all possible.
A pulmonary critical care doctor in suburban Nashville has been among a large group of health providers pleading with Governor Lee for a firm statewide stay-at-home order.
Multiple health experts have deemed a statewide order is essential if Tennessee is going to save lives by mitigating the strain on our hospital system and on medical equipment supplies.
The governor has said in his daily briefings that large urban areas were essentially shut down after various local orders. But legislative Democrats like Mike Stewart think the COVID-19 response from the governor has been slow and muddled.
We need to have a clear plan for testing. We need to have a clear plan for getting people who have coronavirus treated, for protecting our healthcare workers, for shelter in place. We have none of those things right now.
But handling a crisis is what governors sign up to do. No one could imagine it would be COVID-19. Reporting from Nashville, Chris Bungard.